Queensland has recorded another 9 COVID-19 deaths in the latest reporting period, with 7 of those being in aged care facilities. Key points. The CHO says most of the deaths are in older people who haven't received boosters. The CHO says most of the deaths are in older people who haven't received boosters. There have now been 277 COVID-related deaths in Queensland since the pandemic began. There have now been 277 COVID-related deaths in Queensland since the pandemic began. 2 million rats have arrived in Queensland ahead of school starting tomorrow. The state recorded 5,746 new cases. But Chief Health Officer Dr. Gerrard said there had been a substantial reduction in hospitalisations, with 726 people currently in hospital and 47 in ICU. Of the 9 deaths, 2 people were unvaccinated, 2 had only a single dose, while 4 had received 2 shots. None had received their booster. Chief Health Officer Dr. Gerrard said the pattern in the state's deaths was becoming increasingly clear. Queensland COVID-19 snapshot in latest reporting period, deaths, 9 new cases, 5,746 Queensland's vaccine rollout, percentage of those aged 16 plus first dose, 92.14%. 92.14% second dose, 89.92% latest case information from Queensland Health. Most of the deaths we are seeing in Queensland are in the UN-boosted older age group, so UN-boosted older Queenslanders are at highest risk of death, Dr. Gerrard said. Also, there is a significant risk of serious illness and death in the unvaccinated younger age group as well, but as we're now close to 90% double-vaxxed, we focus more and more on those boosters in that older age group. There have been a total of 277 COVID-related deaths in the state since the pandemic, with 268 of those occurring since December 13th, when Queensland's border reopened. Evacuation of aged care home last resort. There were reports on Saturday that the COVID-stricken Jata Gardens facility would be evacuated after COVID-19 claimed the lives of 15 residents and infected almost 200 residents and staff. The Federal Health Department later confirmed an evacuation was not required. Deputy Premier Stephen Miles said such an extreme measure was a last resort. Evacuating aged care facilities is a very big and difficult task. I know firsthand how challenging it can be and how disruptive it can be for those residents, he said. These are, by and large, not very mobile and well folks, and so, if you think about moving people who have mobility issues, many of whom have dementia and confusion issues, moving them from their home can be very dangerous for them. Mr. Miles said the situation at Jata Gardens was indicative of a national issue, and the crisis was not confined to deaths from the virus. It's the cumulative impact of staff shortages, of isolation requirements, of other supply chain issues, he said. We've got people now who have been isolating, who are feeling very isolated. The impact on their mental health is significant, or they are not getting the regularity of care that they used to, whether that's a bathing or other assistance. They are not getting, in some cases, the medication and medical care that they would normally receive because their facility has staff off with COVID or because they've potentially been exposed to COVID. So, right now, that's the epicenter of what's going on. Rat stock arriving ahead of school start. Mr. Miles said more than 2 million rapid antigen tests have arrived in Queensland ahead of tomorrow's return to school. We have a very detailed return to school plan that has been implemented across schools. The last element of that plan was making sure we had sufficient rapid antigen tests so that parents could get their children tested if they had symptoms, Mr. Miles said. We now have those tests. They are on their way out to schools and will be available during the week. Dr. Gerrard said it was very unlikely that schools would be shut and that he was not expecting the return to school to substantially impact hospitals. This is not like 2021. There are no major plans to shut down schools. We want to be able to control this virus at a classroom level, he said. If kids are sick, well then they need to go home and quarantine. But our goal is not to completely contain this virus. Our goal is to minimize hospitalizations. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. Watch duration, 2 minutes 3 seconds 2 minutes, and 3 seconds. Data shows many older Australians haven't had their booster.